That's a great question, because accessing healthcare is something I sometimes, it should be easy for me because I'm a counselor. I work in queer and trans health. I literally design resources teaching people how to do this, and yet it's still hard for me.
There's so many things about me, and particularly I have like a lot of intersections. I'm multiply marginalized in a lot of different ways. So, when I sit down with a health provider without an explicit invitation to share a number of things about myself, I will just share what's asked. Even as like a bi person, sexual orientation was pathologized not that long ago as like a psychological disorder. So I think that even just going to see a health provider, for me at least, there's an automatic vulnerability, and not sure how secure, how safe I can be. So I might not be in a space where I'm like volunteering everything about myself. I think that there's a responsibility for a provider to like kind of invite me to know, or let me know in some way, or demonstrate that, yeah, like I want to know about you and I'm curious about your experiences as a person and how that might fit into like what we're doing here.
It took 10 years for me to get a physical because I was so uncomfortable in my body, but also really uncomfortable who I'd be exposing my body to. And that was a lot of what I think why I turned my back on not going to get checkups or visiting the doctors, not building a relationship with the doctor.
One of the experiences I have as like a fat person is being fat shamed or having my weight brought into situations that maybe my weight doesn't have to do with. It seems like no matter what health situation I enter, as a fat person, your weight is always up for discussion. It isn't for me, but it seems to be for every single other health provider. So a safe encounter for me would be if a medical provider or a health provider like says, hey, like, are you interested in talking about your weight or weight loss? And I'd go, no. And they'd be like, okay, cool. And then just move on.
A lot of people that are in active addiction, they're not doing it out of spite. They're not doing it to upset other people. And when someone's in it, it's really, it takes being put in a really hard place to get out of it. I would want people to have more compassion. But I feel like that's just so like easily said, because I know these people that come in with these addictions can be very challenging. They might not be coming all happy in there. They might be really in psychosis. They might be angry, aggressive. So I know that it could be very challenging, but I know it's also, I don't know, I think there's kindness in a lot of people that come across the opposite. So to maybe just have more, I wouldn't say empathy. If you don't understand it, it's hard to have empathy, but maybe more compassion.
The once friendly lab person that was doing an ultrasound with my wife and I before Nico was born, and she was so friendly in the room, talking to us, and she was just wonderful, eh? Yak, 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 yak. Up a storm, smiles and laughter, wonderful conversation. And then she leaves the room, and 10 minutes later she comes back, and bam, she didn't say a word. And she barely looked at us, and it was like, what would you think about that? You would arrive at an assumption that, gee, did she read our chart, or like what is it the brown thing? Like, is it the is it the trans thing? Or it was First Nations, it was lesbian, it was queer, it was trans. Like, look, which one is it? Or is it all of the above? I think there's times when I can suspect, but I don't confront. At that point, I was like, gee, did you experience the same thing I did? Yes, my wife did, and wow, that was really weird, wasn't it? Like, what was that about? But at this point, sometimes, more often, I'll just remove myself and go someplace else.
Yeah, when I first came to Vancouver, I've had the opportunity of meeting other trans fellows, but every single one of them started the process with testosterone. And I was also under the impression that was because it was traditionally the way that you had to transition. You had to go on testosterone, you had to impersonate and be and almost act the male part before they would go further into doing surgeries and everything else. Met with my trans doctor and got the assessment done. And I felt like there was like a tiny bit of like, are you sure you don't want to go on testosterone? Like, are you sure this isn't what you want to do? Because once this psychological assessment was done, it was clear, like, you have gender dysphoria and yes, you are trans. Now let's look at testosterone and upper or bottom surgery and what that looks like for you. And I kind of felt like there was a pressure to, that maybe, are you sure this isn't something that you would really like? It's not that I don't want some aspects of it. I would like the physical build, but I don't want to, there's other things that I don't want from it right now. So I really felt like I wasn't trans enough, or I wasn't going to be seen as an equal to the trans community because I was going about it a different way, or because I maybe don't want to go about it a certain way.
Accessing healthcare, it's sometimes I have to trade off like dignity for care because I don't know how someone will be. There's a lot of, I think, biases that happen in the health profession, and I've had some really amazing experiences and I've had some negative experiences, and unfortunately I don't think that I can determine what kind of experience I'm going to have before I walk into the room. And I think it's like super important to you know, I really want to share that that's what I carry with me every time I see a health provider. Like, anywhere that I go, no matter how small or how big, I don't know what kind of treatment I'm going to get. And as a person who's caring about my health, it may be my dignity that I have to leave behind that day in order to be well.
So I think, yeah, even though doctors are like super busy and they're not going to like always remember everything about you, just that kind of feeling that the care is genuine and that you matter in a sense, because I think a lot of queer and trans people have had experiences in their life where they felt like they don't matter and where they felt like they, you know, were irrelevant and they felt like they were pushed to the side. So just those small moments where, yeah, you feel like someone cares about you is really important.
People come to the hospital because they want some sort of pain to go away, whether it be emotional, physical, mental. It is a form, like, I would never want to go to the hospital unless I really needed to. So it is a form of, like, we're just really wanting help, like, and to see it from that perspective.
I think it's really important that we look at health outside of this medical model that a lot of us have been trained in. In that model, we're taught to kind of look at the individual, look at symptoms. Do we assess, we diagnose, we treat? And that doesn't leave a lot of room for the whole world that person inhabits. But actually, I think it's a lot more useful if we think about health and wellness as something that includes our social locations, our context, where we live, who we interact with. Are we socially isolated? Are we connected with others? Where are we in community? What we can access in terms of services, what we can access just in terms of like basic survival things. Like if I'm working with someone who comes in, I'll meet someone and they've been given some diagnosis and they say, well, I'm anxious or depressed, and I'll be talking to them, and it's like they've insecure housing. It's like, of course you're depressed, right? And that maybe they actually can't access housing because there's someone who is read as like sort of gender variant or other, and then they encounter transphobia, which means it's harder for them to get housing. So is the problem their anxiety, depression, or is it transphobia? So I think we really need to take a look at these bigger picture things to really understand health and see the role that oppression plays in when people have barriers to health. Oppression's nearly always somewhere in there.